look at the large proportion of asymptomatic cases, 80%, if you look at the low case fatality rates, and these have held up until this point, then you could say that we are making progress. I would have to add some caveats to what I'm saying, and that is that there are some reasons that may also account for some of the rapid reduction in the active cases that we are observing. The first that I'll talk about has to do with the redefinition of conditions under which one can be discharged. In the beginning, if you recall, you had to be asymptomatic and you had to get 2 negative tests within the 2 weeks before you'll be discharged. And because this ended up in a situation where you had a clutter within the hospital, so people are relatively well, but because they are waiting for the second negative test, they are not discharged and they are not declared as recovered. And also because of the backlog in even conducting these tests rapidly, we could not have that much of a rapid decline. But we are in a situation now where we've adopted the WHO guidelines. So if you are asymptomatic, you will be allowed to go home and be managed as such. If you are symptomatic, 14 days after the onset of the symptoms, and then 3 days when you are no longer showing symptoms, you'll be allowed to go home. So I think that this is less stringent than the first one. And you would be made to go home. So more people are going home, and that is where people are being labeled as having recovered.
Because it's recovered / discharge.
Yes. So then it makes the numbers drop a bit more rapidly. And then also, I think that in terms of the test, we've not been able to ramp up the test as much as we needed to. Ghana was doing a lot of tests and so on and so forth, but I mean, what the Ghana Health Service put out is that by 28th of July 2020, we had done over 33,000 tests. So that if you look at if you count from April up until this time, you look at the number of months, it means we are averaging maybe 8,000 or so tests per month. And in some other places, at the peak of it, people were averaging somewhere between 10,000 and 15,000. So I wouldn't say at this point that our testing rate is that high. So sometimes that may also give you a certain sense that your numbers are low, when in reality, you may not be testing as rigorously as you should have. But to the extent that even when people test positive, we are getting good outcomes, I'll be happy with that.